One thing too, for my own personal thing there, because I use a catheter, a doctor, urologist would tell me that because I'm using a catheter, there'll always be some urine there, so there'll always be some bugs in there, so I'll never really get rid of the antibiotic, they get rid of the UTI. However, I think I proved to them that if you keep at it and at it and at it for like 2.5 months and killing the bugs all around, then it will finally kill them everywhere. Good day. My name is Dan, and I live in Ontario, Canada, just a little town just north of Toronto. I'd share my UTI journey with you because the chronic part was interesting, and it has its own special things, I think, to talk about. I know that most UTIs, it seems to be with women, so why do I, relatively healthy male, get UTIs? Because I'm also a partial paraplegic, so things don't work down below my waist, and I have to self-cath all day to pee. So, you know, you're putting a catheter in and out, 6 or 7 times a day. The odd time over the years, you probably make a mistake and some bugs get in there and you get a UTI. They were no problem. Like, if you get a UTI like everybody else, I would get one, take an antibiotic for 7 days, it'd be gone, it'd be fine. Until one day, I think I'm as certain as I can be, from a cystostomy, I picked up the UTI from hell. That's where I got the one. And you take the regular antibiotics, wouldn't kill it. The regular time, the doctor would say, well, try this. And we tried that. And I had a good doctor who would try anything. He was trying different antibiotics, and I talked to different infectious disease specialists. And they both different. The first day they said, oh, because of the way you are, you're going to have to stay on antibiotics for a month or more. And they both said about the same thing, for a month, maybe 2 months. Well, that didn't work for me. I had suggested treatments from urologists. They would say, oh, just take extra vitamin C, and and the odd flare up now and then. Of course I would, because it wasn't gone. And now they want to say, well, take extra vitamin C and a prophylactic antibiotic and expect the odd flare up. And of course it just did that. It would flare up, sure as heck, I don't think a lot of the doctors understand what it's like to have a chronic UTI. So after I tried no antibiotics with no success, I tried some strange things because I cath. I could I decided I could put different things, instill them into my bladder. I got a great big syringe, and I made sure everything was sterile, and I put antibiotics in it first, and I could shoot that right into my bladder. And I tried that for a couple of times, and the antibiotics in my bladder didn't do anything, didn't no better than the other antibiotics. So after that, I read a book, and it made a big difference. I'm going to just show you the book first. The book is called Cystitis Unmasked by a Dr. James Malone Lee, and it's there's the book. Sorry, my director's over there. It's got some really interesting concept to it, and I'll read part of it right here. I came across a book called Cystitis Unmasked by Dr. James Malone Lee, which made more sense to me than anything the doctors were telling me. The basis of the book in one line is to pick a first-generation antibiotic and take it every day for perhaps over a year, probably experiencing many ups and downs along the way. Yes, I gotta put that in there. I'll talk about that. The mean treatment duration is 383 days in the book, with 75% of patients coming off antibiotic treatment within 12 months. The treatment also includes a medication called methenamine, also called hippurate and other names. And I've got hippurate. Well, I've got it here. Is it interesting? It's also called methenamine, hippurate, urophosphate, uracil. It has methenamine in Canada. It's got a DIN number. It's got everything is here next to Canada, except you can't buy it here. Pharmacists can't get it. So I ordered it. I could order it from Great Britain or Australia, which I did. I had trouble for a while. I had to order it to the States. They wouldn't ship it to Canada. But now I can get it shipped right to Canada, so it's better now. Methenamine, it's different. It's not an antibiotic. It's an antibacterial, and what it does is when it gets into your bladder, it changes your bladder into a formaldehyde gas, something like that, that kills bacteria. Now the beauty of what they say, and I think it's been said a few times about this drug, is that with antibiotics, your body or the bugs, whatever it is, will get used to them, and they'll come back and they will be no good anymore. With methenamine, Hippurate, I've got a bottle here. I don't know where it is. Oh, here it is. Here. Here's what the bottle looks like here that I bought, that I get, and it's just a pill like that, about that big. You can break it in half. It's got a place to break it in half, and so it turns. The beauty of it, that your body can't get used to formaldehyde, and so it'll just keep killing bugs forever. And where an antibiotic seems to go, it works with the reproductive cycle of the bugs. The methenamine, Hippurate, just kills them dead. Bang. Okay. Many ups and downs. I was discouraged many times. I thought I was so clever. You think after being on something for 3 months, and I could test with test strips, and I was lucky that when I used test strips, and I got a lot of different test strips and used them, and the two different things you're looking for are nitrates and leukocytes, right? And anyway, if either one of those shows up, you got a problem. And by the color of it, how red it would get. If it got red right away, you knew you had a real problem. A little bit of pink, it's no big problem. It's called a trace, and I think a lot of people have a trace. I'm not worried about that. The book, if you choose to go on the book, and here's what it says, and let this sink in. The difficulty that's in the whole process there is that success depends on patience, perseverance, and dogged persistence. Read that for you again. The difficulty is success, and it's a difficulty because success depends on patience, perseverance, and dogged persistence. Flicking on and off treatment is counterproductive, and I flicked and I flicked off, and it was freaking counterproductive. I finally ended up, it's a big problem. Oh yeah, what I found out too, or what I think is that why it takes so long is because the bacteria can live in a biofilm in your bladder. And if you've been in this stage, you know what I'm talking about, the biofilm. And how long can it live in there? I could never get a real answer, but I know it could be months. And then because you'd stop taking your pills, you do everything right, and sure enough, in a little while later, bang, you had a UTI again. So I know that they live in there. So I had several ups and downs, and I made 12 full notes of my whole journey. 12 pages of just got in there how many nights I would take, how many pills I would take at night and in the day, and what it would go in, and how it was all working out. My breakthrough, I think, finally came when I was lucky enough to get another spinal cord injury. So I was in the hospital for about 2.5 months between the spinal cord injury in the hospital and the rehab. And during that time, if you go to the hospital and you tell the nurses, this is my medications, they will give them to you. And so at that time I thought, because I was out of my element too, I'm going to go right on the full dose. So I went on to 4 of the first generation antibiotic that you can look up in the book or figure out what it is, and 4 a day, and 2 Hippurate a day, which is the maximum dose. And the nurses, they were so great, hospital and at rehab, where they would, if I was at rehab out and about somewhere on my scooter, they would come and track me down. And so without fail, for 2.5 months, I got it every day without fail. And I think that was the difference when I came out of there. It made a big difference. I said I'm in Canada, and I've not mentioned, because I'm in Canada, we have the greatest healthcare in the world, I think, and it's all for free, except for your freaking taxes, of course. But without it, I would have been lost, and it's helped me through the whole thing, along with my wonderful family, my wife getting through the whole thing. Of course, you got to be careful about reinfection. I'm very careful about that, and because the main thing I have to work with is my catheter, and I've developed a way of opening the catheter with the special. It's all sterile inside, and I can take that, I hold that catheter, and I can put it into a sterile grease it up, and then I can hold on to it and not touch it at all, and it works fine for me. So that has worked out okay. With a UTI, a chronic UTI, it's difficult to sometimes even when you don't want to travel because you never know when it's gonna hit and come back. And even we went for one family thing to Jamaica, and for some reason when I got to Jamaica till I came home, my UTI went from being thought I'd gone right to being bad again. So anyway, strange things can happen. I guess out of my element as well. Maybe too much drinking, too much candy. I don't know. Anyway, a couple of important things I think I wanted to talk about is that getting back to how long bacteria can live in a biofilm. People would go there and they'd have a test, and their test would come back negative. Keep coming back negative. Well, of course it would, because that in the biofilm, it's not doing anything. It's just hanging around there until later on, like I said, a month or 6 weeks later when it comes out and starts biting away at you again. So there's that there. One thing too, for my own personal thing there, because I use a catheter, a doctor, urologist would tell me that because I'm using a catheter, there'll always be some urine there, so there'll always be some bugs in there, so I'll never really get rid of the antibiotic, they get rid of the UTI. However, I think I proved to them that if you keep at it and at it and at it for like 2.5 months and killing the bugs all around, then it will finally kill them everywhere. Now I've been 1.5 years UTI-free, and right now I take half a Hippurate in the morning, half at night, and I take half of the first generation antibiotic. I take 1.5 at nighttime too, sometimes through the night, and that has worked out well for me. So far, I've had no problems with it, and I think that's about it. If you do decide to go with the book, reason I got two, I got one for myself, and I bought one for my doctor to read, and I told him certain pages to read, and if he was a busy man, and you'll see there's a certain pages that make more sense than others, or just easier to read. Some is very doctory sort of talk, but I got through it all right, so probably you can, eh? So anyway, I hope you have a good time with your UTI and you can kill it. Okay, have a good day, bye.
Hi, I'm Jenka from Love. I hope you found this video helpful. There's no single approach that will work for everyone when it comes to health, so I invite you to watch more patient videos here or read more stories over on our website, liveutifree.com, and take what resonates with your journey. Remember, it's always best to consult with a clinician before trying something new. If you'd like to share your own story, please get in touch. Our info is in the description. And feel free to reach out with any question about patient stories, finding a clinician, or your own personal experience. Also check out the description below for more helpful resources. If you find these videos valuable and would like to support what we do, don't forget to subscribe and hit the bell button to stay updated when we post new content. Thanks so much for watching and for being part of this community, and remember, your story matters.